In this video, we're going to continue and finish the types of ointment bases. Last time we finished oleaginous bases. This time we are going to talk about absorption bases, water-removable bases, and water-soluble bases. And we're going to begin with absorption bases. What are the general properties of absorption bases? They are water-free, fatty, and insoluble in water, just like oleaginous bases. However, they can absorb water, and therefore they are more hydrophilic than oleaginous bases. And because they are more hydrophilic, we can incorporate active constituents into absorption bases. However, those active constituents would be insoluble in the absorption base. That means that the active constituent does not partition itself more towards the vehicle, which is exactly what we want. Remember, from previous videos, we established that the drug should be of different nature to the base so that it partitions itself more towards the skin to ensure a greater drug release, greater penetration, greater absorption, and greater bioavailability, and therefore we can maximize the effect of the ointment. Absorption bases can also act as pharmaceutical adjuncts. What does that mean? It means that if we wanted to incorporate small volumes of aqueous solutions into absorption bases, we can. Can we incorporate aqueous solutions into oleaginous hydrocarbon bases? No, we can't. But if we used absorption bases as an intermediate, we can. What does that mean? Let me explain. So if we wanted to incorporate an active constituent into a hydrocarbon base, we can't do it directly, but we can use absorption bases as an intermediate. How would we do it? First, we incorporate the aqueous solution or active constituent to the absorption base, and then we take this mixture and we incorporate it into the hydrocarbon base. For which drugs can we do this for? For sodium sulfactamide and for gentamicin sulfate. And finally, absorption bases act as occluding agents and emollients just like oleaginous bases. However, they have a less occlusive effect. We have two types of absorption bases, emulsifiable and emulsified. Emulsifiable is where we permit the incorporation of aqueous solutions to form a water in oil emulsion. Therefore, these are not initially emulsions. However, via incorporation of the aqueous drug, we form water in oil emulsions. There are two types, anhydrous lanolin and hydrophilic petrolatum. And then we have the emulsified absorption bases, which are already water and oil emulsions, which allow for incorporation of small quantities of aqueous solutions. So our drug here is an addition to the emulsion. And there are two types, hydrous lanolin and cold cream. Let's begin with the emulsifiable absorption bases. As we established, they are 100% fat initially, but upon incorporation of the aqueous drug, they form a water in oil emulsion. There are two types, anhydrous lanolin and hydrophilic petrolatum. Let's begin with anhydrous lanolin. They contain no more than 0.25% of water, and their advantage is that they are used as a vehicle for compound tincture of benzoin in treatment of bed sores. So there is this active constituent called compound tincture of benzoin. It's used in treatment of bed sores, and the vehicle for this preparation is anhydrous lanolin. And with that, let's take a case study. A patient presents with a broken leg and needs a prescription to treat his injury. What should the pharmacist prescribe for him? Let's break up this case study bit by bit. So our patient has two problems. The first problem is that he has a broken leg. And the second problem is that because he has a broken leg, he is most likely not moving at all and he's staying and resting at bed, so he will develop bed sores. So we can predict that the pharmacist will prescribe him two types of preparations. The first preparation will contain an active constituent to treat the broken leg, and the second preparation will contain an active constituent to treat the bed sore. So let's see the answer. As we said, a pharmacist will prepare a drug or a preparation to treat the broken leg, and he will also prepare an ointment with absorption base plus compound tincture of benzoin, our active constituent, to prevent bed sores. Additional advice that the pharmacist could give the patient is to move around to prevent the bed sore. I know that the patient has a broken leg, and of course, initially he won't be able to move. However, throughout the treatment process, as he gets better, he is advised to move in order to prevent bed sores. The disadvantage of anhydrous lanolin is that it is too sticky. This is its consistency, it's sticky, and it has an offensive odor. And another name for anhydrous lanolin is anhydrous refined wool fat. Hydrophilic petrolatum is often refined and present in commercial products such as Aquaphor and Aquabase, as we can see here, and it can absorb up to 3 times its weight in water, which is a very good advantage. On the other hand, when we talk about emulsified absorption bases, which are initially water and oil emulsions and allow for incorporation of small amounts of aqueous drugs, there are 2 types, hydrous lanolin and cold cream. So you might be wondering at this point, how is cream used as an ointment base? Well, there are certain types of creams, like cold cream, which we can use as an ointment base as well. So in this case, cold cream has a dual function. Let's begin with hydrous lanolin. It contains 25 to 30% water content, which is a great amount of water content. So we can establish that this preparation has water content and it also has fatty content, and therefore there is no chance of phase separation from ever happening. And it also ensures good incorporation of the drug in the base, whether the drug is lipophilic or hydrophilic. Why? Because if our drug is lipophilic, it will reside in the lipid portion, and if it is hydrophilic, it will reside in the aqueous portion. Other names for hydrous lanolin is simply lanolin or hydrous wool fat. When we talk about cold creams, the presence of water in this base is useful as, again, it allows for incorporation of both aqueous and non-aqueous drugs. And we can use cold cream as a vehicle for lactic acid and glycerol to treat dry skin. Now that we've finished talking about absorption bases, we're going to talk about the last 2, which are water-removable and water-soluble bases. Water-removable bases are hydrous, they are water-loving, and this is the first difference we can observe compared to the other ointment bases that we've talked about. Whether it was oleaginous bases or absorption bases, those were anhydrous. Here, water-removable bases are hydrous. They are water-loving. They absorb water, and therefore we can predict that we can indeed incorporate aqueous drugs. Water-removable bases are oil in water emulsions, and therefore the dominant phase is water, which again supports the incorporation of aqueous drugs. And it has a hydrating effect. Therefore, we can use it for patients with dry skin. And it is water washable and water removable. When I say water washable, I mean that if we washed it with water, it is easily washed off. This is not the same as oleaginous and absorption bases. They are washable, but not completely. So, and as compared to water removable bases, they aren't washable. Therefore, in the comparison, as we will see later on, we will say that oleaginous bases and absorption bases are not water washable, whereas water removable bases are water washable. The advantages of water removable bases is that they can absorb discharges from the skin. So in a patient with certain discharges which must be removed, we can prescribe for him an ointment with a water removable base. and it is also suitable for application to hairy areas, unlike oleaginous and absorption bases, because oleaginous and absorption bases were fatty. They had a very dense, sticky consistency, and therefore it would be very inconvenient to the patient or to the consumer if they applied it to a hairy area. The disadvantage of water-removable bases is that they are susceptible to microbial growth due to their high water content, and the solution to this is to store it in a tight, closed container and to add preservative. Finally, water-soluble bases. They are soluble in water, they absorb water, they are water-washable and water-removable, but the difference between water-soluble bases and water-removable bases is that in water-soluble bases, we can only incorporate water-soluble components. We can't add any oleaginous ingredients, and therefore water-soluble bases are greaseless. The disadvantages is that water-soluble bases exert a dehydrating effect as its own water content is evaporated, and hence it is prohibited for application to dry skin. You can never, ever, ever prescribe for a patient with dry skin a water-soluble base ointment. Never. Second, preservatives must be added due to the high water content. And third, water-soluble bases soften greatly with the addition of water, and therefore they cannot accommodate for incorporation of large amounts of aqueous solutions. And hence, usually, we incorporate solid substances instead. Now that we've finished talking about our ointment bases, here is a comparison and a summary. I want to focus more on the highlighted points of this table. The oleaginous bases and the emulsifiable absorption bases are anhydrous. Water-soluble bases are soluble in water, whereas the rest are insoluble. Water-removable and water-soluble bases are water-washable, non-occlusive, and non-greasy, and the only type of ointment base which does not absorb water is oleaginous bases. Finally, how can we select a suitable ointment base? So we want to prepare an ointment, but we don't know which kind of base to prepare, whether it will be oleaginous, absorption, water-soluble, or water-removable. How can we decide? There are certain properties that we can consider, like the desired release rate of the drug from the ointment base, the desired target site of the drug, desirability of the occlusion of moisture from the skin, so whether we want our ointment base to be occlusive or not, stability of the drug in the ointment base, depending on whether we have a lipophilic drug or hydrophilic drug, effect, if any, of the drug on the consistency of the ointment base. For example, when we were talking about liquid paraffin, we used it as a softening agent, and hard paraffin, we used it as a stiffening agent. Desire for a base easily removed by washing with water. As we saw in the comparison, water-removable and water-soluble ointment bases are easily washed with water. And finally, characteristics of the surface to which it is applied, which is the characteristics of the skin, whether we are applying the ointment to healthy skin or to abnormal skin like dry skin. And that will be all for this video.